Hi, and welcome back to our show. My name is Dr. Kesty. I'm a double board certified dermatologist. I practice in St. Petersburg, Florida, and I'm very excited to have our guest today, Dr. Murphy Mastin. He's also a double board certified dermatologist. He practices in Missouri. He's a very talented Mohs surgeon, general dermatologist, and cosmetic dermatologist. So, Dr. Mastin, tell our audience and our viewers a little bit about yourself before we dive into the topic today, which is going to be preventing skin cancer. What are the 3 ways that you can prevent skin cancer in yourself or a family member? So before we get into that, Dr. Mastin, tell us a little bit about yourself, where you train, and about your practice.
Yeah, thank you so much. I'm Dr. Mastin. I am a board certified dermatologist, as she stated. I work in a rural hospital setting in a critical access area, and I deal with a significant amount of skin cancer. But I also treat medical conditions such as eczema and psoriasis. I also own a medical aesthetics practice, and I perform laser quite often. So I think overall, I kind of run the gambit from young to elderly, and anywhere from cosmetic to advanced surgical oncology. So.
That's awesome. So very, very talented guest today on our show that we're very excited to dive into this topic because I know you see a lot of people with skin cancer. You
Yes.
practice in an area where there's a massive population at risk. So let's talk about the number one way to prevent skin cancer, which is sun protection. So, Dr. Mastin, when you're talking to your patients about sun protection, what do you tell them?
I sound like a broken record, but, but it's data backed. Ultimately, the key things that we can do, uh, sunscreen being number one, 30 SPF or greater, broad spectrum sunscreen,
Okay.
meaning that it picks up more of the wavelengths of light that can cause cancer and photo aging. So, majority of the aging that we see on our skin is actually related to sun damage, and I think that's a huge part in terms of the cosmetic aspect, and sometimes that can appeal to people that way. But also, it's a 1 in 5 chance that you'll develop skin cancer if you live to the age of 70 in the United States.
Okay.
So, not an uncommon thing. It affects all skin colors, races. Nobody is without risk of developing skin cancer, and that's one of the key things is to mitigate our sun exposure, and when we are out in the sun, to try to reduce our risk. So, once again, 30 SPF or greater sunscreen reapplied every few hours. Broad spectrum. I like mineral sunscreens myself. That's like zinc oxide or titanium dioxide. It'll have a metal name in front of it, and then it'll have oxide usually. So those are things
Okay.
I like. In addition to those things, sun protective clothing is something I preach pretty commonly. I think
Yeah.
that overall, a tan was considered to be healthy, and I'm seeing a lot of these patients come and say, I used to rub down with baby oil and iodine, and I was out in the sun, and now they're unfortunately paying for it. But I
Yeah.
think overall, the people that I see, just by way of work out in agriculture where I'm at, their sun exposure is significant. So,
Mm.
sun protecting hats with at least 4 inches of brim, long sleeves, protecting your hands. Photo aging on the hands is a giveaway for aging as well. So, I think that's something we can do. And I often see skin cancers in those areas as well. And that's function.
Mm-hmm.
So I think that overall very important to protect those areas as well. Less thought of. Staying out of peak hours of sun time, which would be 10 a.m. to 2 p.m., almost like hands on the steering wheel, 10 and 2. Those are kind of the areas you think of.
Okay.
And then a UV index. If you ever use any of the weather apps, they'll often have a UV index.
Okay.
If it's 3 under, usually pretty good. I think you could probably go without sunscreen, though I wouldn't recommend it. Anything above that, sunscreen. If above 9, stay out of the sun. Those would be the
Okay.
key things that I would say can really help to reduce your risk of sun exposure, which is the leading cause of modifiable risk, things that we can control for developing skin cancer.
So that's a lot of
It
options.
is.
If you had a patient that was like, okay, Dr. Mastin, I know there's a lot of options. What's one thing I can do every day for sun protection to mitigate my risk for skin cancer? What's the one thing you would have someone do?
If I could be in a perfect world, it would be sunscreen.
Okay.
If I was in a real world, which I am, I often recommend sun protective clothing. It will say
Okay.
UPF on it,
Hmm.
and can indicate the degree of protection. They have a special weave or certain materials or certain treatments that help to go and reduce the amount of UV light or ultraviolet light that reaches our skin.
Okay.
And I think that's something that we don't have to remember to continually apply.
Mhm.
And I think
Okay.
overall, from that standpoint, I really strongly encourage people to wear hats.
Okay.
Also protect your eyes. We're
Hmm.
in UV radiation all the time that causes skin cancer, but also cataracts. So lighter eyes are at risk for that. So I think that's a modifiable risk too. Good polarized sunglasses can be helpful, but sun protective clothing by far and away. I think it's just
Okay.
something once you put it on for the day, you're likely not taking it off.
Yeah. So if you're going to do one thing, maybe just change your shirts to sun protective shirts and you will help your skin cancer risk significantly.
100%.
So,
My grandmother has ivory skin, and it's because she had on about 3 layers, a do-rag,
okay.
everything covered up, sunglasses, you wouldn't know it was her.
Okay. Okay. So she's our skin cancer idol here.
Oh, yeah, she's got perfect skin, she's amazing.
Okay, perfect. I love it when patients, to explain how the sun really causes a lot of photo aging. Some dermatologists, and I'm not sure who started this, but I know a lot of dermatologists will say, like, well, just look at the skin on your booty or, your abdomen, because that's what your face would look like if you didn't get any sun. So
Yep, that's very
patients
interesting.
always laugh when I say something like that because they're like, oh, actually, that does make sense, but it's also funny. So,
Absolutely. Yeah, there's that New England Journal of Medicine photo that we all see as dermatologists, and
yeah.
it's a trucker that drove for over 50 years, and the degree of aging on the left side of his face near the driver's side window is significant compared to his right, which was sun protected.
So,
Yeah.
okay, great. So sun protection. I mean, we're dermatologists. We're not going to, talk about skin cancer without plugging for sun protection. So let's move on to kind of newer technologies, kind of more exciting things. So if you have a family history of skin cancer or you've already had a skin cancer and you're interested in preventing skin cancer, we talked about number one, which would be sun protection. So let's talk about number two, which would be topical therapies. So, Dr. Mastin, tell us about how you would counsel your patients about topical therapies to prevent getting skin cancer.
Yeah, thank you so much. So technically treatment as well, but I think the use of
Mhm.
5-fluorouracil cream, very
Okay.
important, it's also known as Effudex, but it can cause quite a reaction.
Okay.
There is good collagen production as well. So I do try to apply that to my female patients. I show them their husband's skin that's been treated. It's very smooth and it looks
Okay.
very rejuvenated,
Okay.
almost like a superficial chemical peel. Also,
Okay.
the use of retinoids such as
Okay.
tretinoin, um,
Mhm.
tazarotene, other things along those lines, they can be very helpful.
Okay. So there are topical options that you can talk to your board certified dermatologist
Absolutely.
about to get, long-term cosmetic results, but also prevention of skin cancer. And are these things that have robust data behind them?
Actually, they do. I would
Okay.
say that overall, those are kind of gold standard for what we have now at this time. I think
Mhm.
that overall, just from clinical experience as well, the amount of benefit that patients can derive from these
Mhm.
topicals can be significant from what I've seen to where if you have over 10 precancers called an actinic keratosis
Mhm.
on your skin whenever you come in for a skin check, it's around a 10% lifetime chance you'll develop squamous cell carcinoma.
Oh boy. Okay.
So I love to see that reduced. It's not fair to patients to go around with liquid nitrogen and spray all over their body. That's not very fun. I think my record is 50 shots in
Oh
one
my
session, and there was
gosh.
people that did more. But it's just not a very efficient way to treat. Ultimately, if you're
Mhm.
treating with these topicals such as 5-fluorouracil,
Mhm.
you're treating background sun damage as well that we can't
Mhm.
even see on clinical exam just yet. It hasn't come to fruition.
Mm. So you're actually treating the DNA damage that causes precancers and skin cancer in the future.
Absolutely.
So,
Yes.
well, that's amazing technology that we have that. And
Yeah.
from a patient standpoint, let's say I come to you as a patient and either I've had skin cancer or, I've had a lot of time in the sun, my mom has skin cancer, something like that. What does that treatment actually look like? Is that a once a year treatment, twice a year treatment? What is the downtime for something like that?
Would that be in terms of the 5-fluorouracil or just in general?
Both, yeah.
Yeah, I think overall with that, I will definitely recommend yearly treatment with that just to
Okay.
continue that risk reduction
Hmm.
and to treat background sun damage that has accumulated over the year. And
Hmm.
usually it's a less robust reaction each time that you treat because you've actually wiped that out. It doesn't work unless the cells are actually damaged.
Hmm. Okay.
So you'll see spotty areas of breakdown and
Hmm.
erosion and crust. So it's kind of a good clinical
Hmm.
correlation to that I see.
Another topical would be chemical peels. So, can you
Absolutely.
tell us a little bit about chemical peels for the prevention of skin cancer?
Yeah, so there's some nice data on those, such as medium depth chemical peels, which once again, you would want to go to somebody that's well versed in the
Hmm.
application of those chemical peels. It's a controlled injury to the skin,
Hmm.
and it can help to remove some of those atypical or abnormal cells that are going to go down that pathway to becoming skin cancer, possibly. So,
Okay.
once again, oftentimes we're doing something called field therapy where we're looking at your skin and we see such broad sun damage and we
Mhm.
see precancers and discoloration that indicate UV damage or sun damage, and we're treating those with this field therapy because we can't pick everything up on exam that's going to
Mhm.
actually come and be precancer or progress to skin cancer.
Mhm.
Nice data on that.
Okay, so using chemical peels, obviously by a dermatologist.
Correct.
to prevent skin cancer as well as 5-FU and some retinoids or tretinoin. So,
Absolutely.
well, those are great topical options. So, number one, sun protection. Number two, topicals, 5-FU, retinoids, chemical peels. Let's talk about number three, which would be light based therapies. So, I would say the two light based therapies are going to be PDT and lasers. So, tell us a little bit about lasers and the data behind that, what the patient experience is like as well.
Yeah, thank you so much. So, once again, a controlled injury to the skin with laser, much like a chemical peel, just a different mode using specific wavelengths of light that would go through and have a certain biologic reaction. And there's a lot that we can't see in addition to what we do see whenever we treat people with lasers. More recently, the FDA did approve the use of a thulium laser, which is a fancy name for a laser that hits more superficially, and it kind of resurfaces the skin at the top layers where skin cancer develops.
Hmm.
And it kind of wipes out some of those abnormal cells and lets them to repopulate. It also turns on certain genes that go through and kind of activate our immune system. We have these things called zombie cells where there's cellular senescence or it's kind of sleeping on itself and it's not really doing anything. And we want to go through and kind of turn those back on. And also, as Dr. Kesty has talked about in the past, use of broadband light,
Hmm.
IPL as it's also known as, can help to go through and lengthen telomeres, which are a way that our cells divide. And there's only so many divisions those cells can do. So I think
Hmm.
there's a lot that we're still learning, but the data is promising.
Hmm.
Once again, CO2 laser, which is a resurfacing laser, erbium laser, all these, which she does,
Hmm.
they go through and they help to, once again, treat damaged skin cells and to repopulate with healthy skin cells and make sure that our immune system surveils appropriately. Just a really wonderful, robust response in building collagen and elastin. I love that when I see my arms of patients who may have had a lot of sun over multiple years, easy bruising, thinning of
Yeah.
skin, skin tears. These are things that can be improved as well as discoloration. So there's a lot of benefits, I think, overall from cosmetic to the actual functional aspect of why we treat.
Hmm. Yeah, I agree. So PDT and lasers are just really good options for patients
Absolutely.
that, I have a lot of patients that will come and consult with me because they've had a skin cancer and they've maybe had a surgery or Mohs and didn't really love that experience. We're left with a scar and really, really, really are motivated to not get skin cancer again. So it's
Absolutely.
great to have so many options for patients to treat the DNA damage
Yeah,
that's been done by the sun and which obviously is going to decrease the amount of skin cancer that they get moving forward. So, lots and lots of options. It sounds like the number one thing to do is just to talk to a dermatologist about what option would be right for you in terms of, your family history, your past history, the amount of sun that you've had, and, talk about those three things: sun protection, topicals, and light based therapies, including PDT and laser and really seek out which would be the best for you, which your board certified dermatologist is definitely going to be able to help you navigate that as a patient. So,
absolutely.
yeah. So, tell us, Dr. Mastin, where can patients find you if they want to come see you for your opinion on which of these three would be best for them?
You can see me at Citizens Memorial Hospital in Bolivar, Missouri.
Okay.
You can also find me at my medical aesthetics practice in Bolivar, Missouri, which is MD Lux,
Okay.
MD-LUXE,
Okay.
and also Pioneer Dermatology in Lee Summit, Missouri, which is
Okay.
a area of Kansas City.
Okay, great. Well, yeah, go see Dr. Mastin. He's obviously extremely intelligent, very well versed in all of these options for treating skin cancer and preventing skin cancer. Well, thank you so much for joining us. This has been a lot of great information, and we really appreciate your time.
Thank you so much for
Yeah.
having me. Thank you all.
Thanks for listening.